Australia has become collateral damage in an escalating dispute between European officials and AstraZeneca over the delivery of its COVID-19 vaccine. The EU has blocked a shipment of 250,000 doses that were due to be sent here. All this is taking place a week after the first batch of AstraZeneca vaccines arrived in Sydney, and on the same day it was given to an Australian recipient for the first time. Here's political reporter Jane Norman.
Another first for Australia. And the verdict?
I couldn't even feel it at all.
Dr Caroline Phegan is a rural GP and immunocompromised.
I feel very privileged and I'm very honoured to be the first person in Australia to receive it.
Another V-Day for Australia, another vaccination day.
A milestone overshadowed by a dispute playing out 16,000 kilometres away.
It is arguably the most intensely competitive international environment since perhaps the Second World War.
Despite assurances from the European Union, Australia's become the first casualty of new export controls. Italy blocking 250,000 doses of the AstraZeneca jab produced at a facility outside Rome.
In Italy, people are dying at the rate of 300 a day. They are in an unbridled crisis situation.
A victim of vaccine nationalism perhaps, but Australia's also sent a warning.
It's important that contracts are honoured.
Australia's ordered 3.8 million doses from overseas. It's unclear when the next batch will arrive, but the government insists the rollout remains on track.
The really exciting thing is that in the week beginning the 22nd of March, we'll start to release the onshore supply of AstraZeneca vaccine.
Up to 1 million doses a week produced at Melbourne's CSL facility, coinciding with the next stage of the rollout. Phase 1A expands to 1B, which includes all adults over the age of 70, Aboriginal and Torres Strait Islander people over 55, healthcare workers and people with underlying health conditions. So far, 72,000 Australians have received their first COVID jab, including 20,000 aged and disability care residents. The government says the rollout is going to plan, despite missing its first week target. But the big test will come in a fortnight's time, when the rollout ramps up and more than 4,500 GP clinics begin administering the jabs. Jane Norman, ABC News, Canberra.
Let's take you live to London now. Our Bureau Chief Samantha Hawley joins us. Sam, as we just heard the Prime Minister say, contracts must be honoured. Are more shipments from the EU likely to be held up?
Well, Jeremy, I guess that depends a bit on how many doses Australia has ordered from European manufacturers. But yes, it is possible because, of course, this wasn't just Italy's decision. It was endorsed by the European Union Commission. And just as Scott Morrison says that contracts need to be adhered to, so do these European nations. And AstraZeneca has slashed the number of doses that were meant to be going into Europe by the end of this month from 90 million to 40 million. The other point to make, I think, Jeremy, is that Europe has had a really lacklustre start to its vaccination campaign. Here in the UK, for instance, about 30% of the adult population has already been vaccinated, but that figure's sitting at around 8% across Europe, so it has a lot of catching up to do, and it needs those doses, and it needs them quickly.
Samantha Hawley reporting.